Hello. At the assisted living place that I was able to visit, I had initially been told that I would be able to work with a group of 3 patients with dementia. But when I got there, I was informed that one of them, a man, was unavailable. They didn't really elaborate on why, but they said he would be unavailable for the session. So I ended up working with just 2 patients. One was a lady, and I refer to her as Miss G, and the other was a male who I referred to as Mr. Mr. J. His name was Jim. But they were both really interesting. I was able to work with Miss G a little bit more. She was a little more receptive and expressive. Mr. J was really he just really seemed like he was in his own world. He never really answered anything that I asked him. He sat there, but he would just mumble a lot, and he would talk to himself. And then he started, when I was doing other stuff, talking to Ms. G, he started like rocking back and forth. I never really got him to focus and was never able to work with him. Ms. G was kind of in and out. I had to talk to her and try to get her to focus a lot. She went on off topic, and she would start asking me questions about who I was, and just start asking me like where she was. She was sort of in and out with her confusion, but I was able to get a little bit out of her. As far as like the activities, Mr. J, like I said, he completely just basically shut me out from the beginning. I wasn't able to do much with him. For my first activity, the ask and answer activities of daily living, because of the way that I sensed Ms. G and I didn't want to make it too complicated, I started just with A and B answers for the questions. And a couple of times she would tell me like A or B, but she never really would say the whole answer back to me. She would just say A or B, and I got the feeling that maybe she really wasn't even understanding sometimes what I was asking her. She was just saying A or B just to say it, basically. She would sometimes if I said something, she'd like get a word, and then off of that word she'd start talking about it. Like when we talked about Christmas holiday, she kind of started talking about holiday, and then we tied it back to Christmas, and then she said, "Oh yeah, I know what Christmas is," and we were able to talk a little bit about it. But some of the things that she would say wouldn't entirely make sense, and it was just a lot of work trying to get her to focus back onto what we were doing. So the first activity wasn't very successful. I wasn't getting a lot from her, so we moved on to the second one. Second activity was better. It was more casual, and I tried to keep the conversation going as much as I could. Like I was saying, she would get off topic constantly, but she was talking more and seemed to be more receptive to what I was asking. I did use my note cards, and I brought some visual cues for help. I didn't rely 100% on these, and I had to improvise a lot and just kind of work with what she said, or skip over something, maybe jump to a different topic, just depending on what she was giving me. I brought a magazine like that had like holiday stuff on it for Christmas, and I brought a Santa hat, and I tried to bring a couple of more items that kind of related to what we were talking about. Like for sports, I also like brought a baseball, just small things that I thought would help engage them. Like I mentioned earlier, the Christmas holiday was kind of the thing that we were able to talk about the most. I was able to ask her a couple questions, and she was able to remember a couple things. She talked about like foods that she might have enjoyed before, and just little stuff like that. Let's see. Overall, I did have a very interesting experience with the patients. I think next time I will definitely anticipate spending more time with them, because just to have that extra time where they're getting off topic and me trying to refocus them. And of course, I will try to be more prepared, because, the amount of just kind of improvising or things that can go wrong. I really thought that my first activity would be like a really strong one, but it ended up working that the first one wasn't something that really engaged the patient, and so I had to move on to the second one. So I definitely will try to be very prepared next time, more than I was now. And, now that I have a feel for it, I think it'll be a little bit easier. Next time, I will introduce myself and tell them a little bit more about me at the beginning. I know since their focus kind of shifts, it may not help as much, but maybe just to try to get it out the way to say it. But let's see, I will also, I noticed that the visual items that I brought worked really well to get their attention, so I'll try to have a few more items and use my tablet or my phone to help. Something else that I thought would work really well is maybe next time, and especially with a bigger group, if I ever get to work with one, have something like a ball or just something that they can hold each time that it's their turn when you're talking. That way, you know, if I'm holding the ball, it's because I'm talking, and then when I give it to whoever's next, they're going to hold it as they're talking, and maybe we could even like write something on it, depending on the activity. But I just think it would be something a little more fun and hands-on, and just keep it, just to keep it interesting and keep them engaged. It was very, very interesting, and I really did enjoy it. I had never been around anyone with dementia, and so it was different, but it was an interesting experience, and I enjoyed it. Thank you.